This is a H&E staining of histological breast tissue. The lobules of the mammary glands are distinctive from the stromal tissue as they form circular structures plaited at some proximity to each other. These are composed of an inner lumino-cuboidal epithelial layer surrounded by a myepithelium cell layer. The lactiferous ducts are also distinctive from the stromal tissue, which are composed of epithelial and myepithelial cells. The stroma consists of adipose and fibrous tissue. The ducts and the lobules are jointly supported by a basement membrane separating them from the stroma. This is a H&E stain of the histopathology of the breast in the patient. We can see that the nuclei have stained purple, which allows us to see various pleomorphic nuclei and epithelial cells. The epithelial cells are interspersed within the stromal tissue, confirming carcinoma invasion. There is no differentiation between myepithelium and epithelium cells. The ducts are not differentiated and are not distinct from the stroma, apart from the low quantity of collagen seen demonstrating stromal tissue. The patient should not have many lobules nor ducts within her breast, as she is postmenopausal. Since the postmenopausal breasts have a reduction in glandular tissue with a relatively increased stroma, which is not seen in this core biopsy. This is an immunohistochemistry of estrogen receptors of the patient. Various pleomorphic nuclei are seen stained at different brown color intensities, confirming the presence of estrogen receptors expressed in tumor cells. The higher the intensity, the greater the ER expressed. Here, a great distribution of cells associated with a high expression of ER is observed. This is an immunohistochemistry of progesterone receptors of the patient. A similar status can be seen in the core biopsy of PR staining. Here we can also see cells that have a high degree of PR receptors expressed in the nuclei. This is directly linked to genes involved in overexpression of the PR receptors. PR and ER receptors are normally associated with invasive ductal carcinoma of the breast. This is the immunohistochemistry of the HER2 receptors in the patient. HER2 is a transmembrane receptor and it can be found expressed solely on the epithelial cells of the carcinoma. There is no positive reaction seen in the stromal collagenous tissue, but just the cells associated with the invasive tumor, confirming that the carcinoma originated from the epithelial of the ducts. This is the K5 immunohistochemistry stain of the patient. Here we can see the myepithelial cells are stained positive for K5 antigen by monoclonal antibodies. They are present in the ducts and lobules of the breast. However, we can see hyperplasia within the lactiferous ducts of the epithelial cells. This is seen as the epithelial cells are punctured through the myepithelial layer and the basement membrane, covering the ducts and invading surrounding stromal tissue. This is a way of determining whether the cancer is linked to the myepithelium or epithelium of the duct or lobules of the breast. The myepithelium also expresses K14 and is a similar staining in comparison to the K5 core biopsy. This is the immunohistochemistry of the smooth muscle myosin staining. We can see it is expressed in myepithelial cells and blood vessels, and it is negative for this carcinoma. This is the list of references.